Hello, I'm Dr. Anthony Wheeler, and I'm telling you everything that you need to know about pathology. Now, what's going on in this cartoon image here? Something with the bladder? No. Something with the prostate? Yes. We're going to be discussing this and much more in this presentation on prostate pathology. This is covered in your book, Medical School Pathology and Step 1 Review. You can scan the QR code to get to all the information you need to succeed in pathology at your level. Now, prostate pathology. The prostate, as we know from anatomy, is a small, round gland in men that helps in the production of ejaculate. And here we have the various anatomic features of the prostate. Note the seminal vesicles, note the various zones of the prostate, note the penile urethra, right? The prostate is located at the base of the bladder and surrounds the urethra. And this is a picture from your finger when you were doing the prostate exam. You do such great, thorough examinations. You should be proud of yourself. Now, since the prostate is anterior to the rectum, the posterior aspect of the prostate can be palpated, as you know, using a digital rectal examination, DRE. The prostate consists of glands and stroma. An inner layer of luminal cells and an outer layer of basal cells make up the prostate gland, right? It's a gland, right? The prostate, since it's a gland, secretes some sort of fluid. What's that fluid? It's an alkaline, milky fluid that combines with sperm and seminal vesicle fluid. Now, some prostate pathology that you must be aware of, right, for the real world and for test world is acute prostatitis, chronic prostatitis, BPH, right, benign prostatic hyperplasia, and obviously prostate adenocarcinoma. Here we can see a micrograph showing a normal prostate cancer, or is it? Why don't you take a look there? You see the glands? Some of those glands look a bit atypical, right? Now, as we should be aware of, the prostate is glandular tissue. And here we can see a sketch of the microscopic glands of the prostate. Note the lumen and the wall of the gland, and the area between the glands is the stroma, right? We're going to get into this. Now, here we have a micrograph showing an inflamed prostate. How do we know it's inflamed? Well, there's lots of inflammatory cells that are present right there, right? You see those dark basophilic cells, or basophilic is a fancy word for blue, right? You see all those blue cells? Those are leukocytes. So let's talk about acute prostatitis. That's a sudden prostate gland inflammation, and it's typically brought on by bacteria. Common causes of acute prostatitis include Neisseria gonorrhea, Chlamydia trachomatis, Pseudomonas, and E. coli. Symptoms of acute prostatitis include dysuria, right? A little pain when urinating, right? That's understandable. And chills and fever. On the digital rectal examination, the prostate would be soft and squishy. White blood cells would be seen in the prostate secretions, and the causing bacteria may be identified with a culture, right? So you future microbiologists out there, or internal medicine doctors that go into infectious disease, right? You should be aware of this. And here we can see an abscess of the prostate indicated by the red, resulting in urinary retention. And here we can see a micrograph showing a neutrophilic infiltration of the prostatic glands, right? Those neutrophils trying to fight off the bacteria. You should be able to see the neutrophils, right? I'll help you a little bit. If you look to the right side of the screen, maybe if the center is a clock, if you look around 3-ish, 4-ish o'clock, you should see a bunch of neutrophils. Now, you see this white fluid coming out of there? That's abscess drainage. Abscess drainage with transurethral resection of the prostate. This is because of an acute bacterial prostatitis with an abscess formation, right? Now let's switch gears from acute prostatitis to chronic prostatitis. Chronic prostatitis is inflammation of the prostate that lasts for 3 months or more, right? 3 months. Symptoms of chronic prostatitis include dysuria, pelvic pain, and even low back pain. White blood cells are seen in the prostatic secretions, but cultures are usually negative in chronic prostatitis. And here we have a pie graph showcasing the typical causes of chronic prostatitis and their various percentages. Now, BPH, you'll see this a lot because as men age, a condition known as benign prostatic hyperplasia or enlargement of the prostate gland becomes more prevalent. Symptoms of benign prostatic hyperplasia include hydronephrosis, right? This all goes down to the anatomy. You know the anatomy. Poor bladder emptying, right? Makes sense. You see the pictures. You can imagine how that happens, right? Increased bladder infections, right? You close the lumen up, stuff gets stuck. Stuff doesn't like to be stuck. Stuff starts misbehaving. Problems initiating urination, and even problems stopping the urination. All from benign prostatic hyperplasia. Dihydrotestosterone is a hormone that promotes the development of masculine traits like I have. Pass me my axe. And is associated with benign prostatic hyperplasia. Benign prostatic hyperplasia may be treated with a 5-alpha reductase inhibitor, right? You remember that from biochem? 5-alpha reductase inhibitors stop the conversion of testosterone into the active form, dihydrotestosterone, right? Or at least more active form, right? So if you have less of this very good testosterone, then less likelihood for the prostate to enlarge and close up your urinary tract. Now, dihydrotestosterone causes hyperplastic nodules to form in the prostate by interacting with the androgen receptor on the stromal and epithelial cells, right? Benign prostatic hyperplasia may result in smooth muscle hypertrophy of the bladder wall that increases the risk of bladder diverticula. Due to the increased number of glands, prostate-specific antigen, PSA, is frequently only slightly elevated, typically less than 10 nanograms per milliliter. The use of alpha-1 antagonists such as terazosin in the treatment lowers the blood pressure by relaxing the vascular smooth muscle in addition to smooth muscle in the body. 5-alpha reductase inhibitor blocks conversion of testosterone to dihydrotestosterone and takes months to produce results. Side effects of medical treatment of BPH include gynecomastia, right? And sexual dysfunction, right? Here we can see various histographic representations of benign prostatic hyperplasia versus normal high-grade prostatic intraepithelial neoplasia and prostatic adenocarcinoma. So A is normal, B is benign prostatic hyperplasia, right? Glands looking nice, just a little enlarged. C is something that you'll probably not be asked ever about, but if you are, it's prostatic intraepithelial neoplasia, right? Precursor lesion. 2, prostatic adenocarcinoma. And D, the worst one, prostate cancer. Benign prostatic hyperplasia can also look like this. Here we have a micrograph showing nodular hyperplasia, left of the center of the prostate from the transurethral resection of the prostate, also known as a TURP procedure. And here we have a large amount of stromal tissue involved with benign prostatic hyperplasia. And here we have some pathologic findings of the specimen obtained from a radical prostatectomy. In various micrographs, we can see these pathologic features. Some of them even suggest malignant tumor, and some suggest otherwise. Now, importantly, when you see these prostatic secretions, that hints at a benign process, right? You see that there, the big oblong rock-looking thing that's in between the gland. Now let's talk about something that's very, very, very important, because you're going to be asked about it on tests and in real life. This is prostate adenocarcinoma. Very important. Let's make sure this all sinks in. Prostate adenocarcinoma is a type of cancer that starts in the gland cells of the prostate and affects only men, the prostates. Prostatic adenocarcinoma is the most common type of cancer in men and the second leading cause of cancer death. Prostatic adenocarcinoma is typically asymptomatic. Prostate-specific antigen, PSA, and a digital rectal exam, a DRE, are the first screening tools used when someone turns 50. When normal serum prostate-specific antigen is 5 nanograms per milliliter for people aged 40 to 49, it is related to benign prostatic hyperplasia, whereas it is 5 nanograms per milliliter for people aged 70 to 79. At any age, patients with prostate-specific antigen levels greater than 10 nanograms per deciliter are quite concerning. Reduced free prostate-specific antigen, which results in bound PSA, is symptomatic of malignancy. A prostate biopsy is necessary to confirm the existence of prostatic adenocarcinoma. Histology of prostatic adenocarcinoma shows the presence of tiny invasive glands with noticeable nuclei. The Gleason grading method is used to describe prostatic adenocarcinoma. Because tumor architecture differs from area to area, it is necessary to evaluate several tumor regions. 2 distinct regions each receive a score between 1 and 5, which are added together to yield an overall score between 2 and 10. The higher the score, the worse the prognosis is. And unfortunately, prostatic adenocarcinoma may metastasize. It frequently spreads to the pelvis bones or lumbar spine. Low back discomfort and elevated levels of serum alkaline phosphatase, PSA, and prostatic acid phosphatase are the symptoms of osteoblastic metastasis. Localized disease is treated by prostate resection. And hormone suppression is used to treat advanced disease and lower dihydrotestosterone and testosterone levels. Leuprolide, a continuous gonadotropin-releasing hormone, or a GnRH analog, causes the hypothalamus to shut down as luteinizing hormone and follicle-stimulating hormone levels fall. The androgen receptor is competitively inhibited by flutamide. And with that, you completed a very low-yield presentation, but you are consistent. You're doing everything that you need to do to succeed, and you will succeed. I guarantee it. You have a winner's mindset, and you have the discipline and consistency of a champion. Keep up the good work, and I'll see you later.